So questions that you need to answer, right? What are health insurance options and what resources provide that information? And so now we're going to take a deeper look into how to answer these questions. So it's important to recognize that there are different factors that contribute to which health insurance plan you might choose for yourself or your family. And so things like if your spouse or partner has off-farm employment and that place of employment offers healthcare options, that's an important consideration because sometimes those plans are, really good and very cost effective. Another thing to pay attention to is the state in which you live. And this reflects really that some states have expanded Medicaid, whereas other states have not. And also, the cost of plans also vary by state. So the other thing that is interesting and something to pay attention to is where you live in the state may impact the available health insurance plans and policies. And that a lot has to do with the insurance company themselves and what parts of the state or the region that they are allowed to service. So your income and age, and if you have a disability, that may impact the kind of insurance that you choose. Also, the number of family members or employees you're trying to cover. And then the business structure of the farm. That isn't so much a type of plan that might be impacting which one you can choose, but maybe how it's managed on your taxes. So all of these things have to be considered when you're, making some decisions about the coverage that you're thinking about, and then also what might be the best price and the best plan. So other factors that kind of contribute to determine whether to offer employees health insurance. So again, it may have to do with the number of family members and employees. Like, are you going to try and cover everybody? Are your family members employees? And then are there others? The business entity organizational structure that you have, whether that's a sole proprietorship or LLC or S Corp. Again, that has a lot to do with kind of taxes and how the expenses of healthcare are deducted from your taxes as an expense. Another important consideration is, how much money do you really have to support health insurance costs? Becomes a deductible expense, but how does that offset with the other expenses and the income of your operation? Another consideration is if you purchase healthcare plans through what is called the healthcare marketplace, and we'll talk about that in a minute, there are some tax incentives for small business owners. And then, as I mentioned before, there are some different tax rules, right, about offering insurance to the self, family members, and employees that are part of the equation. So when we think about what are the options, right, there are several, as you can see, and we're going to go over these in just a minute, but there are employee-based health insurance and employer-based health insurance and or an association membership. For example, Farm Bureau or the local Chamber of Commerce, they often offer health insurance options for small businesses. There's the health insurance marketplace, which we'll talk about. Health insurance provider, maybe it's the company itself. For example, in our state, in Delaware, Blue Cross Blue Shield actually will provide insurance directly to a consumer or to a small business. But then there's also broker dealers that can help you find a plan. There are what are called skinny plans or short-term gap plans. Say you're out of insurance for, say, 3 months and you need something to cover you during a time period in between insurances. Certainly, if you are a veteran or part of the armed forces, there would be health insurance through them. For limited income families and individuals, there is Medicaid and the Children's Health Insurance program, which they call CHIP. And so again, there's some income eligibility pieces there, but many farmers fall into that income range, and we'll talk more about that. There are Christian healthcare plans or healthcare sharing ministries, which is not an insurance, but it kind of works like an insurance in that you're contributing in, and as you experience healthcare costs, then you would turn those in, and then that ministry will decide whether or not to reimburse you. And then when you hit 65, there is Medicare. And so that's the plan that's out there that helps offset costs in our senior years. So at this point, I am going to turn things over to Jesse, who's going to talk a little bit about these different options and kind of go a little bit deeper. So I'll turn it over to Jesse.
So I did post in the chat box a fact sheet that Maria initially drafted, and I added on to it that explains all these options that we discussed today. And throughout the presentation, I'm going to throw a couple other things in the chat box that can be resources for you as you explore making decisions, things that we found on the internet, really, that we thought was going to help you in terms of making some decisions. And also a resource that our health insurance team created. When we're talking about employees, why you'd want to offer health insurance to employees, it's a great recruitment tool, right? And a retaining employees tool. And so, and it's a good thing to do, to be able to hire someone and to be able to offer health insurance to them. And so actually, after I get through a couple slides, Maria is going to come back and cover these areas, but she's going to talk about the employer-sponsored group health insurance plan. So something you get through a provider or a broker. She's going to talk a little bit about the marketplace that offers what they call SHOP. And then maybe you find it financially challenging to be able to offer insurance, but you want to contribute, and you can use something called a health reimbursement account to do that. And I think Maria was going to advance slides for me. So the first one there is we're jumping back to insurance options that you provide for yourself and your family. So we're going through the list that Maria had covered 2 slides ago, right? So one is to get your insurance through an all-farm employer, right? The all-farm employer, and we know that about 50%, if not, I think it's a little higher than 50% of farmers actually get their insurance through all-farm employment. And we combine that kind of with association membership because it's being offered by someone else and you're signing up for it. You can see there some of the benefits that include, hey, doesn't matter where you get it from, if it's being offered, at least you're covered. Employers can typically offer insurance that is less expensive because they're buying it in bulk, right? They're covering a lot of people, and as a result of covering a lot of people, it's cheaper than if I was going to go out and get a policy myself. One of the challenges there may be a limited number of plans to choose from, because really whatever that